Welcome back to Session 8, Self-Care Within Universal Health Coverage 2030, Lessons from the Pandemic Lockdowns. We are happy to have as moderator Mr. Perez, President of the Philippines. Joining him are Kawaldip Sehmi, you know him already. We also have, once again, Orajitt Bumrungskulswat, Board Member of IAPO. And last but not the least, Deon Schoombie, CEO of Consumer Healthcare Products Australia. You can find their full biographies on the Congress website. Please send your questions via the Q&A tab in the
Good afternoon, everyone, and thank you, Cara, for the kind introduction. So the topic today is on self-care. I just want to quickly introduce it to everyone. So this session will look at self-care and its evolution post-pandemic. It will look at new partnership framework and sharing of responsibilities. WHO defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. To ensure we have sustainable UHC 2030, we must optimize how we design and use our future healthcare services. The pandemic showed us a lot of care move out of the official healthcare pathways and under health professionals to self-care, community pharmacies, and home and supported by telehealth. So let's kickstart this afternoon by calling in the CEO of International Alliance of Patients Organization to talk about concept of self-care and how it integrates with health system and universal health coverage. Please welcome Kawaldip Sehmi.
Thank you very much, Paul. I will first start off by saying that self-care is part and parcel of universal health coverage. You can't see it separate from that, in that it must be working in tandem. Also, the second part is that self-care is part and parcel of other healthcare being provided. So in other words, self-care is not something unique and thought over and isolated. It is part and parcel of other healthcare services, other healthcare components. So self-care enhances and augments care that we have. It's essential to have that in mind when we look at self-care. Secondly, as you say, the self-care is more about an empowered individual. It's not about an individual on their own right. It's about an empowered individual. It's an individual that has support around them. The individual isn't reliant too much on the health system itself or the health profession, but he or she has got other secondary support around them. We know in order for self-care to take root, there were several things that the Global Self-Care Federation found out in their recent survey to develop self-care readiness of economies and health systems. They said the first thing was that there should be stakeholder support and adoption of self-care methodology. That it's very important that the government, the chief stakeholder in many countries, and then healthcare providers and others in the health system adopt the approach and maintain support for it, that there's political will there, and then you ensure that you have got that understanding and awareness and communication on it. The second part that we came across in that index was that the consumer and patient must be empowered. You cannot expect someone to make a decision regarding their own healthcare when they haven't been empowered. They don't know enough about the disease they have. They don't know enough about the medication they're taking. They do not have enough knowledge of where to get additional support, what if worries, and especially in what we call the pharmacovigilance system, that sometimes adverse events happen in any case, whether it's tertiary healthcare or self-care. Those are part and parcel of health systems. What to do in that instance. Then I think the most important part, which then combines that individual, personal with the systems thing, is that self-care must be promoted actively through policy. There must be a legal framework around it. There must be a policy frame around it, and there must be encouragement for that. For instance, there may be arrangements there to have every patient with an NCD educated up and brought up and made to be empowered, and funding allocated and a pathway designed for them. There may be issues of medication with consumer pharmacists. We may have community pharmacists engaged in the whole process, bringing them in. So there must be an active policy that is understood by everybody, all the stakeholders. We can't just have vertical policy strands. So this policy must be through the range of everybody, be it the doctor who sees the patient first, the nurse who will be involved with that. How do we put them into this mode and thinking and empowerment? And lastly, I think what the framework asks was the regulatory environment should be made responsible and made in tune with self-care. You find that in many countries, what we here in the UK or elsewhere have got over-the-counter drugs, those are not available. And somewhere conversely, in other places, there are other very dangerous drugs that are made available without supervision. So there's two stories there. So we need that regulatory environment to be looked at through science and evidence-based, and make sure it supports self-care, which means that there must be access to high-quality drugs and information available to that. Now, when this index ran out, it looked at various geographical areas, and I think they found out that we have a long way to go. And I think what was hindering us, or what was keeping us back, was that we hadn't developed a culture for self-care, and that in different places there was different attitudes towards it. And in current climate with the COVID-19, what has happened is many of our health systems are now really short of staff and really short of time and really short of finance. And therefore, we have to then look at that and say, how much of this care can be a responsibility of the patients so we don't overburden our health systems, and how much of it should be a part of the individual health systems concerned. Second, then we looked at was that we talked earlier morning when we opened these sessions about health literacy. We found that we haven't invested enough in health literacy. How much of the individual empowerment was there, and how much of these are in plan and in government strategies are there to look at, from really starting within the school systems and educating, training, and bringing science and self-care and into the whole policy and vision, and make sure that the child growing up now is educated in biology, basic healthcare, self-care, nutrition, and all this, and what to do. In antimicrobial resistance, I think this has become a very important thing, that individual empowerment understanding is absolutely critical. That without their understanding, we are not moving forward, and that antimicrobial resistance has got more chances if we don't take self-care responsibly. Then we looked at the legislation regime, institutional regime. And there we found again that self-care legislation is all over the place. We don't have coherency in the region in Asia Pacific, where different terminologies are being used for it. And there's confused picture about what needs to be done. We need to bring that into focus and clarity, simplify things. We need to say within the Universal Health Coverage 2020, we all have a share to work with this. And I'm asking expert patients, especially amongst us, we have to play a big part in that. The things that we can do for ourselves, things that the health system can do for us, and the things in the middle that we can do together with the health system. So, for instance, surgery, I can't be self-care in that. There is no way I can approach surgery. So that I can rely on the health system. But to design my nutritional plan and my care plan, then I must make sure that I work with my health professionals, talk to them and develop them, and then go home. But the things that taking that medication, adhering to that medication, making sure I take my blood pressure, making sure I'm positive about this, and making sure I'm mentally and psychologically tender, that is my responsibility. I have to make sure. I cannot turn up at the general practitioner surgery and say, oh, well, my blood pressure is shot up because I haven't been taking medication, or I haven't been controlling my sugar levels are gone up. That's self-care. In multimorbidity cases, I think it's very important that self-care is looked at as well. We need support for elderly patients, and to give more time to my colleagues who have looked at it. I wouldn't cover the self-care index yet. We will deal in the questions. I would now like to hand back to Kara and ask her to go forward and ask other speakers to put on this, and I'll be here to support them. Thank you.
Thank you, Kawaldip, for that sharing. A lot of things, a lot of learnings right away. And just a reminder to everyone, if you have any questions, please use the Q&A tab, and we will entertain questions after all the speakers for this particular session. So moving on, let me welcome Kun Orajitt, who will talk about the Thailand experience with self-care and evolution post-COVID-19 pandemic. A virtual welcome to Kun Orajitt.
Thank you, Paul. And good afternoon, everyone. Thank you for providing me a chance to talk about self-care, the post-pandemic evolution in Thailand. Next slide, please. Next one, please. The outline that I would like to speak is self-care in health system, the government support for self-care, health promotion and prevention, Thailand COVID-19 situation as of 11 November, but maybe update for today, and self-care during COVID-19 pandemic situation, the new partnership framework and sharing of responsibility, and lastly, the evolution post-COVID-19 pandemic in Thailand. Next slide, please. Talk about self-care in healthcare system. It will improve health and avoid from disease and sickness, especially those aging group and chronic disease group. Healthcare costs lesser compared with medical treatment costs, and it will improve economic outcome. Also, in Thailand, self-care is promoted and well recognized both in policy level by the government, the Ministry of Public Health, the universal health coverage, and the private sector, and in community nationwide. People and chronic disease patients are more educated and practice self-care personally and in patient group with guidelines provided to them. Self-care activities practiced in communities are promoted and advised by community health center and health volunteers. Next slide, please. And the government funds to promote or to support self-care and health promotion and prevention. Mainly, there are health promotion funds, which are 4,000 million baht or 121 million US dollar this year. It will comprise mainly in healthy community strengthening plan, healthy promotion plan for vulnerable population, and COVID-19 health promotion and prevention. And for the National Health Security Office, especially in health promotion and prevention fund, it will be 21.5 million baht and about 53 million US dollar. And we also have community health promotion fund in the community. It will be about 3,000 million baht or 90 million US dollar. And especially the COVID-19 health fund, the government provide about 50,000 million baht for this situation. It will be 1,500 something million US dollar. And for the Ministry of Public Health in several departments of health, they promote health promotion and environmental health system and knowledge and technology, which promotes public health and environmental health through different level of healthcare facility. Next slide, please. Talk about COVID-19 situation. Maybe I update. The coronavirus case is about 2 million cases since last year. The death is also 20,000 cases. And new cases today is go down. It's about 6,000 something. And vaccinated now is about 85 million doses. And we plan that at the end of this month, it will be 100 million doses. Next slide, please. So, self-care COVID-19 pandemic situation in Thailand play essential role. Due to the COVID-19 patient, they face difficulty of access to healthcare service. So the patient have to practice self-care at home, or we call home isolation, with advice by telehealth and telemedicine. They will register and they will get advice from provider. And also we will have medical device and means sent to their home. And in case of emergency, they will be sent to hospital. The government health insurance will cover the cost of self-care in those cases, so it releases the burden of the patient. Self-care have to be included in healthcare system and in health insurance coverage for the efficient treatment. Next slide, please. And also we provide health education and digital health, which is necessary at this time to provide to people and patients. Like my organization, we have trained the digital health capacity building to the patient organization as well. The policy advocacy and empowerment of the patient group in self-care also needed to change their health behavior and improve health condition. Good collaboration with healthcare provider will create more effective and continuum of care. Next slide, please. This is some guidelines like the COVID-19 vaccine provide to the people. Also 14 days for home quarantine and guideline for washing the hand during a day several times. How to do. Next, please. There are also self-care practice program in community, like home community screening prior to coming to the community, and collaboration with hospital, community health center, and health volunteer. This is happen in every community. Next, please. For the home isolation that I mentioned before, after they already register and if they appropriate to stay at home, the clinic medical staff will monitor their health conditions twice a day via video call, and the meals, medicine, and necessary medical device like the oxygen measure will be sent to them while they stay at home. Next slide, please. For the community isolation, that is for those who are not proper to stay at home. So they will be separate to stay in the community isolation places and will be treated by the provider, and also they will have a health volunteer to look after them. Next, please. We also have a Health Wallet smartphone application. It will make convenient for checking the rights to receive healthcare like the vaccine and the pre-service appointment for health service that's specific, mainly for gender group, aging group, and health risk group. Like myself also use this application because I'm in the aging group already. Next, please. And for the antigen test kit, the National Health Security Office, they will provide about 8 million ATK through the healthcare facility to both Thais and migrant workers for free in order to test by their own. Next, please. And even the students, they also have this ATK test. They have created data link of COVID-19 patient screening from hospital, healthcare facility in different level, pharmacy, and it will shown in digital health pass system, which we call MOPOM application. Next, please. There are new partnership framework and sharing of responsibility between public, private, and community partnership, mainly for screening of COVID-19 patients. This is from the hospital to screening COVID-19 patients in the community, and vaccinate accessibility to different places, also private sector place. We also have few hospitals in many community, and also community isolation, home isolation, telehealth, telemedicine, COVID-19 patient data link, digital health application, patient care volunteer, many. Even many of my friends, they also become volunteer. And also we have food and consumer goods delivery that myself also provide to them. Next, please. Lastly, it's already have evolution post-COVID-19 pandemic in Thailand. We have universal health coverage benefit package to homeless, to migrant workers, to prisoners, to chronic high-cost disease patients and COVID-19 patients. We have collaboration between government agencies in systematic and strategic approach of plans. We have digital health system for screening, consultation, vaccination, medicine, medical device used by provider, patient, and stakeholder in the same system. We also have data link of patient data from community, pharmacy, healthcare facility, and government agency in order to have efficiency treatment. Also have public, private, and community partnership created in systematic and sustainable development. And lastly, self-care and health promotion prevention will play more role in healthcare system, and people, patient also create more awareness. Next, please. I think the last one. So I welcome you people to come to visit Thailand in post-COVID-19 pandemic. I think many tourists, all you people know about these places in the south of Thailand. It's Phang in many islands. So it's beautiful. Please come to Thailand. Next one, please. I think the last one. Thank you for your attention. This is why they come from the hospital and volunteer to screening the COVID-19 patient in the community. สวัสดีค่ะ
ครับคุณครับคุณ Orajitt, yeah, indeed we miss visiting Thailand. So from a Thailand perspective or from a Thailand experience, we move on. This time around, we're going to talk about global self-care index and how it relates to the region. So please help me welcome the CEO of Consumer Healthcare Products Australia, Deon Schoombie.
Thank you very much for that introduction, Paul. Good day and greetings from Sydney, Australia. Now, you heard that Kawaldip mentioned the Self-Care Ready Index in his presentation. What I'm going to do in my 10 minutes is give you a quick and brief overview of the Self-Care Readiness Index. Now, it's a document that runs into almost 50 pages, so it's almost impossible, or totally impossible, in fact, to do justice to it in 10 minutes. But I hope I will be triggering your interest to look at it in more detail. You can download it from the Global Self-Care Federation website, or you can send me an email and I can forward it to you. Next slide, please. So what is the Self-Care Readiness Index? It's an advocacy-centered research initiative which was spearheaded by the Global Self-Care Federation, and it is part of a collaboration with WHO to establish self-care as a global health priority. At its core, the index was developed as a practical tool for self-care advocates to engage with stakeholders. And stakeholders include many people, but in particular, governments and policymakers. And the aim is to promote the value of self-care and to gain support for the adoption of self-care in national health policy. The complexity of the self-care landscape makes empirical and objective measurements of a country's self-care readiness or levels of self-care very challenging, if not impossible. So what the index seeks to do is to provide a snapshot of the self-care landscape in 10 different countries across the world at a specific moment in time, but it also extrapolates on themes and recommendations. The next slide, please. So why develop the Self-Care Readiness Index? We at GSCF believe it's more urgent than ever before to gain recognition of the critical value of self-care and universal adoption of self-care in national health policy. Responsible self-care leads to improved individual and population health outcomes, and it contributes towards sustainable healthcare systems. Inherent in the concept of self-care is prevention, not only of communicable diseases, but as also infectious diseases, as has been illustrated by the current pandemic. And of course, it is relevant, as Kawaldip mentioned, in the pursuit of universal health coverage. Next slide, please. A few words about the methodology. The researchers identified 4 crucial enablers of self-care. The 4 areas that have the strongest ability to influence the uptake of science-based self-care practices, products, and services. Each of the 4 enablers is supported by measurable indicators and concrete sub-indicators or proof points. For each indicator and sub-indicator, the research team gathered evidence through a combination of extensive desktop research, expert interviews, and surveys of healthcare providers and consumers. The 2020 Self-Care Ready Index covers 10 countries, which were chosen in consultation with the WHO to ensure diversity, to illustrate diversity across multiple jurisdictions, international jurisdictions. Next slide, please. During the research, 3 key themes keep recurring as the 10 selected countries were examined. And the research team then made a series of recommendations to address these issues that they have identified. The first theme, and the Kawaldip made this point, self-care is a complex, multifaceted, culturally based concept, and it's defined in many, many, many ways. So the recommendations from the research team and advisory panel is to launch a global advocacy campaign to clarify or develop a single universally recognized definition of self-care, to unite diverse stakeholders and to inspire action. The second recommendation is to develop a new global compact on self-care with the ultimate goal of bringing forward a new WHO resolution on self-care. The second theme that was identified is individual empowerment hinges on ongoing efforts to improve health literacy. And this is, of course, supported by reliable sources of information about self-care and health generally. And, of course, healthcare providers need to be aligned on all of these issues. So the recommendations are: increase the quantity and quality of self-care information available to people. Easier said than done, but it is a goal that we need to pursue. Educate and incentivize healthcare practitioners to support consumers and educate them and raise health literacy in relation to self-care. And then, of course, in the digital age, harness the power of and reach of digital health solutions through the deployment of multidisciplinary care teams. So the third theme that was identified, self-care legislation, was found to be common, but often disjointed and fragmented. There are numerous government strategies, plans, and programs that touch on self-care, but few call it by name and or paint a coherent healthcare policy vision. So the recommendations are to forge a broader alliance of self-care advocates to make the case that investment in self-care results in healthier populations and lower public healthcare costs. Secondly, encourage governments to develop more coherent policies and regulations to integrate the multitude of strategies, plans, and programs that touch on self-care. Now let's turn our attention to the 4 enablers. The index is based on, next slide, please. Thank you. Then the index is based on 4 enablers which are considered to be essential to realize the full potential of self-care in the healthcare system. Each of these enablers are associated with 3 or 4 indicators, as I pointed out earlier. Let's jump straight to the 4 enablers. Next slide, please. So the first one, the expert advisory panel and researchers agreed that the most important measure of a country's self-care readiness lies in the attitudes and behaviors of key stakeholders. And they examined three stakeholder segments. First of all, healthcare providers or healthcare practitioners. Secondly, consumers, who also sometimes become patients, of course. And thirdly, regulators and policymakers. So the 4 indicators associated with this enabler: firstly, the degree of trust and support for self-care amongst healthcare practitioners. Secondly, the trust and support for self-care amongst consumers and patients. Thirdly, the extent to which patients and consumers understand the benefits of medicinal and non-medicinal approaches to self-care. And lastly, the level of understanding of the benefits and value of self-care amongst regulators and policymakers. Now, if you look at the graphic there, you will see the 10 countries listed around the circle there. And on the right-hand side, you will find the 4 indicators. And then you can look for yourself and identify, if you look, for example, trust on the trust on 1.1, how China and Thailand's rates relative to other countries. Now, I need to emphasize at this point, this is not about deciding who's good or bad or mediocre, or some is better than others, but rather a way of looking at self-care and its different components and how different countries approach it. So it's not a scorecard of failing, or it's not a competition between different countries, but it is there to illustrate by way of comparison. Can we move to the next slide, please? So this is a very, very important point that Kawaldip made again in the beginning is person or patient or consumer centricity, the activated consumer. Self-care delivers the greatest value when consumers and patients have a high degree of health literacy and they feel confident and empowered to make appropriate decisions about their health. In relation to this enabler, the researchers identified two key enablers. The first is the extent to which individuals, consumers, patients can readily access their own health data. This, which hinges in large part on the availability of electronic health records and the inclusion of self-care guidance in those records. The second key point here is the level of health literacy. And there are many definitions for health literacy, but it's the ability of consumers to identify conditions, make appropriate decisions in relation to their health and well-being, taking of medicines, etc., etc. So a complex and but critical component and driver of self-care. Next slide, please. The third enabler is about self-care in health policy, and this focus here is on governments and policymakers. The right policy and regulatory frameworks need to be in place to leverage the full potential of self-care. This section assesses countries' current policies in relation to self-care. The four indicators here is the extent to which policymakers recognize, discuss, and promote the economic value of self-care for health systems and the economy more broadly, including the potential for prevention, better resource utilization, and workforce productivity. Second indicator, the extent to which the health system use policy mechanisms to lower out-of-pocket expenses of self-care products and services for consumers. Third indicator, the extent to which health providers provide financial incentives for healthcare. The health system provides incentives for health providers and healthcare practitioners to counsel consumers in relation to self-care. And lastly, given that much of self-care is rooted in traditional and complementary medicines practices, in what ways and which ways and to what extent does the health system recognize and regulate traditional and complementary medicines? So the findings, while near all of the people interviewed acknowledged the economic benefits of self-care, governments do not seem to be visibly intent on capturing the value of self-care. There are some exceptions for, of course. Several barriers were identified, and Kawaldip mentioned some of them all. First of all is the political will. Secondly is the issue of the lack of money. And what underlines all the hesitancy and barriers here is that the benefits or the payoffs of self-care is more difficult to measure, takes longer to materialize when you compare it, for example, to the building of a new hospital or increasing the number of doctors or nurses or improving infrastructure. So these are the barriers. Now, again, if you just look quickly at self-care in health policy, for example, look at compare China, Brazil, and Thailand, seem to be sort of high on that relatively compared to others. So that just sort of illustrates the difference when you compare the different countries. And lastly, ladies and gentlemen, my next slide is about enabler 4, which is about the regulatory environment. This section seeks to measure the extent to which regulatory frameworks support self-care. Consumer access to self-care products and services is determined by regulatory processes which govern the approval of new products, the reclassification of products from prescription to over-the-counter, distribution channels, advertising and promotion, and pricing. So in relation to this enabler 4, key indicators were identified. First of all is the approval process, which I mentioned, to what extent the regulatory review of self-care products is transparent, efficient, and based on scientific evidence. Secondly, the medicines reclassification processes. What processes are in place for switching drugs from prescription to non-prescription? Thirdly, the extent to which consumers can access self-care products through a variety of channels. So whether it's in the pharmacy, the drugstore, or the supermarket, or online. And the last indicator is the ability of companies to create consumer awareness of self-care products through advertising, and also the ability to base product prices on market dynamics. So that wraps up, just as I said, a quick overview, and I do encourage you to have a look at the detailed document. Makes for very interesting reading. Thank you very much for the invitation and for your attention. Thank you. Back to you, Paul.
Thank you, Deon. Hold on for a while, Deon, because you'll bring in Kawaldip and Orajitt for our panel discussion. So if you may have them back on the screen, please. Okay, such an interesting discussion. I want to kick off the panel discussion asking a question to you, Kawaldip. What do you think needs to be done to encourage self-care? I mean, a very basic, question, like what needs to be done to encourage self-care?
I think the first very important element is to show the benefits of self-care. I think this is it's very important amongst patients with long-term conditions. If we can have examples of best self-care, I think within, for instance,
I think we lost him. Okay, I'm sure he'll get back to the call. While we try to get that somebody back, allow me to ask you a question, Orajitt. Quite an interesting snapshot of the Thailand experience. I just want to focus on how did you manage compliance? Now, self-care obviously is to a very large extent, very individual because you're locked out, or it's very individual approach. How did you manage in Thailand compliance?
Since it is a policy also for self-care or health promotion prevention, it's already in the benefit package of health security system, and the government also support the budget through the healthcare facility in the community level, like healthcare center also. So the officer or the provider, they encourage the people, especially in the community or in those chronic patients like diabetes or the high tension patient, even the disability group, to practice self-care much more. And also they have guidelines to provide to them nationwide. And also we have the patient group. They practice self-care by themselves also. The government also support to organize the patient group in order they can have the practice self-care by their own. And they also can consult with the provider in the community health center, in the community level. And also we have district hospital to provide a home visit to them, and also suggest the practice health self-care to them. So I think this is some kind of holistic approach practice to our people.
Yeah, which great to see you back, Kawaldip. So I mean, picking up from what you were saying and aligning it to what Orajitt said, the things that we can actually do to encourage self-care. You might want to continue on that thought.
Yes, as I said, we need to really explain the benefits of self-care, thinking especially chronic conditions. For instance, in thalassemia, where you have regular blood transfusions, you're really good to do iron chelation yourself at home, and all the other things. We have to show what good patient self-care is all about, and show the expert patients who have done it, and encourage by example. I think that's very important when people have seen that. Also, from my previous mentor, Professor Robert West, who was at the UCL, he was looking at addiction biology, and he was looking at social psychological behavior. And he said we need help devices that show us we are doing good. It was reinforcing agents. Your meter says you're doing well, you're below the 2, well done. And some consistent reinforcement that goes on throughout the day, that your BP, your blood pressure is down here, your sugar is below this and that. And that real-time reassurance keeps you on the level. Having to wait for 30 days to go to a doctor and get the blood test, and then you find it is in a worse condition than you really thought it was, is not motivating. So something that gives you daily figures, and you can then change it for the next day. So it almost gives you a personal scorecard you work to. And if this is being recorded automatically, so AI is needed there, automation and clever devices, digital devices well connected with your lifetime. Those are the things that we need for self-care.
I can so much relate when you mentioned about monitoring blood pressure and all that. So yeah, I want to address you on Deon. You mentioned about the 4 enablers in a very interesting presentation. Should all these be done at the same time, or should one come after the other? My basic question would be, what is a viable approach for an early adoption of self-care strategies or policies?
Very good question, Paul. Look, I think let's agree that self-care is a huge topic. It encompasses so many activities and so many players and stakeholders. So it's beyond the capability of any particular individual or stakeholder group. It's beyond the capability of government to do it alone. So I don't think there's one single strategy that will make a difference, but you've got to start somewhere. Our view is that health literacy is fundamental, and that should be a priority. So what is it that we're trying to do? We're trying to change behavior. And how do you change behavior? With the right information, with the right education, and with incentives, and if necessary, even disincentives. So, and who should be doing it? Rosemary Calder, who developed a policy paper here in Australia, said the system is designed for treating disease, not for preventing disease. So the system has got to change to facilitate different behavior. Doctors and healthcare professionals are paid for treating disease, not for educating consumers to prevent disease. So there's got to be shifts in so many places. So I think each and every stakeholder has a role. And if government sets the policy framework and there's the investment, then each of the stakeholders can get on with the job, with a focus on the consumer in the center of it. So we've always got to look at the consumer and what the consumer needs and how he and she can be supported.
Yeah, actually, behavioral transformation is something that we all have to really push forward, with self-care. And one of the things that have actually been a very big impact on behavioral transformation lately is technology. So I just want to hear your thoughts about the role of technologies, or digital technologies for that matter, in the whole world of self-care, given that it could be abused for fake news and things like that. So what are your thoughts about this, gentlemen and ladies? Anyone can actually answer the question.
Okay, Kawaldip, you first.
No. Orajitt.
Okay. Right now, I think the digital technology or digital health, they have played much more role and very important for the healthcare system, especially the self-care, because people cannot go out, people cannot access to hospital, or even in their home, they have to stay in separate room. So they can use the digital system instead of face-to-face, right? And what is about health literacy? So the digital technology is also another important health literacy for the people or for the patient. I realize that also my organization also provide training for the digital technology to those patient group in the basic level and advanced level, so that they can train to each other. Like this morning, when they would like to log in, some of them, they have a lack of educate knowledge to log into our Congress. So we have like group like the patient, they train or they teach each other how to log in. So I'm very happy in that. It means that they realize to know how digital technology, especially in this Congress, you also have the new technology, digital also, that another practical for the patient or the people.
Thank you, Orajitt. May I hear the gentleman your thoughts about the role of digital in terms of pushing self-care as well as balancing versus what seemed to be going on, like fake news and all that.
Yeah, I think it was a very important point that Orajitt raised here, the notion, the concept of digital literacy. We spoke earlier about health literacy and self-care literacy. We've got to bear in mind that self-care has a very strong, or the ability to self-care has got a very strong socio-economic determinant. And we're not all equally talented, and we're not equally privileged in terms of socioeconomic impact. So we've got to be very careful and mindful that we don't make the gap between the health literate and the not so literate even worse than it is. So on the issue of digital technology, I think it will make things easier. It will enhance things. And the example that Kawaldip mentioned here, if there's something that tells you that monitors your heart rate or your sugar level, diabetes, etc., and supports you to take your medication or make an appointment to see the doctor, all of that will help. But also, let's bear in mind that there are people who live in remote areas where there are no pharmacists and very few doctors, and there may be community nurses. So there's an opportunity for digital to reach into those areas. I think so. Let's not just do the easy bit. The people who are keen and already got everything on their smartphones and looking for the next app to be launched, but what of those that are actually not as skilled, do not have access to smartphones or the internet connection? So I think there's a huge challenge here. Let's make sure that we don't leave people behind.
Kawaldip, your thoughts, please?
I think we always sometimes forget the human element in whenever new technology arrives.
Yes.
We should not miss that. We must integrate that into that. Either we go entirely human or we do the technology, and then the two don't work. The human element needs to be integrated. As I said, it's about self-efficacy. And I think, again, Professor Robert West has always said that self-efficacy is about two elements. One is really the motivation to do something, and the second, the confidence to do that. If these are got right, then chances are people will be able to take on this route themselves. And the technology is partway delivering that. It gives you that both worlds. And again, I think the limiting factor is how do we devise those apps and things for improving self-efficacy. I find that if you travel around in Europe and elsewhere, looking at the earlier 320 BC or thereabouts, some of the monuments and structures made in stone, if you look carefully, they're actually designed as if they were made from papyrus reeds or timber. The craftsmen were not appreciating what stone should really work as. Those elegant pictures. Only when Greek came on and they started bringing that elegance is lost. We are working in elegant, what I call analog manner to look at digital and self-efficacy, and we're still doing as if it's in-person meetings. So we need to look at that. Rethink and redesign, and it needs a lot more out-of-the-box thinking. Not just standard format. Maybe a separate group of people look at how you deliver self-care in your health system. Don't use the guys who are on the front line. They will come and pollute the ideas with their own in-person meetings. I mean, it's the way things are designed. So that's what it is. So I rest my case.
Yeah,
I fully agree. We need fresh thinking.
Yeah, well, I think that's what they say, let's build back better, after all this thing that's happening around. So let's build back better. Thank you for your thoughts, and thank you for the time sharing this afternoon. I think that's the only time we've got right now. I think we've planted a lot of thoughts in the minds of all the those who've tuned in today in terms of self-care. Even myself, I've been really open. My mind and my eyes were open to a lot of things. So given that there's so many things that have happened, this is one big step that we can all go through. So thank you, Kawaldip, thank you, Orajitt, and thank you, Deon, for the time. And just to wrap this up, I think a lot of things have happened during the pandemic, and as we move on to what I've called building back better and living with the pandemic, I think self-care can now take center stage, and actually individually or as a community, and we have to embrace it as we really move towards a better, healthcare aligned with the UHC 2030. So for everyone who tuned in, thank you so much for joining this session, and I would like to give back the floor to Kara.